Hello, my name is Tom Holloway and I'm joined by my colleague Ron Miller. We're both consultants with the risk and resilience practice at Sungard Availability Services. And for the next 15 or 20 minutes, we're going to be talking to you about 10 practical steps which will help prepare your organization ahead of COVID-19. To misquote the 19th century Austrian diplomat von Metternich, when China sneezes, the rest of the world catches a cold. The current COVID-19 epidemic is spreading quickly around the world, with cases in more than 85 countries now. This is creating challenges even for the best prepared governments and businesses. We've seen stock markets around the world tumble in recent days, with supply chain shocks due to the closure of Chinese factories, resulting in closures of European and North American manufacturing plants. And with the rates of infections spreading across Europe and North America, even the best prepared organizations will feel the impact. There is a vast amount of information already out there, much of it very useful and pertinent, and plenty that is speculative, indeed conspiratorial. How can you sift through this and come to sensible conclusions that are best for your business and critically for your staff? Well, we've put together a top 10 tips that you should consider going forward. Firstly, put someone in charge. You need leadership. It needs to be visible. Adopt a pragmatic approach throughout. Do not adhere strictly to plans. You need to be adaptive to the situation as it changes around you. Keep tracking events and use trusted sources such as the World Health Organization and in UK the NHS or the CDC in North America. Within your business or organization, identify critical processes and develop and test suitable workarounds. When you've done that, make informed decisions and make practical preparations that will see you through the uncertainties ahead. Throughout, you need to keep people informed, and people means your staff in the first instance, but also the wider audience of customers, suppliers, and the wider stakeholders. Social distancing, keeping your distance, and group gatherings, meetings, conference attendance, and the like all need to be considered in light of the latest advice. Throughout, trust professionals to do their job. Take advice from professionals, and they exist in governments and other NGO-type organizations, but also trust your staff to do the right thing, and in turn, they'll trust you. Throughout, look after the vulnerable. Absenteeism is going to happen. Staff will go sick, and they will need to care for people close to them. And finally, hand washing. We couldn't go through the 10 without that appearing. Soap and water for 2 laps of the happy birthday. I'll now hand over to Ron Miller, who will go through these in a little bit more detail. Ron, over to you.
Thank you, Tom, and hello, everyone. It's fair to say we've been here before in the past. None of the lessons that we've learned in the past can necessarily be discarded. But we'll be talking through some of the experience that we've had from past events such as SARS, H5N1, etc., all of which have occurred over the last 20 years or so. First of all, putting somebody in charge, it's important that you have a pandemic coordinator, somebody with a senior role within the organization and a good mandate and remit to do what is necessary. Some of those things might be difficult to contemplate, but you need to have a person with a seniority that can actually take and make those decisions. Supporting that senior individual, there has to be a large enough team to deal with absences, because undoubtedly there are going to be individuals within the senior management team who are going to succumb to COVID-19 if it spreads as it is at the moment. So identify who your single points of failure might be within that senior management team, and if there are single points of failure, make sure that there are secondary and tertiary roles that people can fulfill if called upon. So succession planning is vital. And if there are gaps in training and knowledge needs, ensure that you're doing something now to fill those gaps, to close those gaps. And as important as well as dealing with people internally within the organization and looking inward, it's important that you ensure that you have liaison with external parties. So who are the groups that you may consider to be stakeholders, whether they are customers or regulators or key partners or suppliers? You have to consider how they might communicate with you and how you will communicate with them. As Tom had said earlier on, there is a need for a pragmatic approach. So while it's essential to make plans, it's the planning process which is the guiding area in this, not necessarily the plans themselves, because plans that you make this week might not be relevant next week or the week after, because the situation is a rapidly changing one. So ensure that you're flexible and take a thoughtful approach to making decisions rather than just simply knee-jerk reactions. Follow the advice from those health agencies that are relevant, and ensure that you don't just do things because you need to be seen to be doing something. Because if you just do anything, very often it's likely to be counterproductive to what you're aiming to do. And this is a situation which is going to prevail for the next few weeks, months, many months, in fact. So this is a marathon, it's not a sprint. You have to act accordingly. And ensure that you're adopting strategies, not just plans, because, as I said, the detailed plans you make for next week might not be up to the job when next week appears. Keep tracking events, use trusted, reliable information sources. The World Health Organization, and in the UK, the NHS, Public Health England, and the various other national health bodies across the United Kingdom, together with the Health and Safety Executive. CDC for North America, certainly for the US, and other relevant bodies. Those will all be pushing out timely information and sensible information that should be trusted. One of the key things that you can do, of course, is make use of information that you've already got under your belt. Business impact analysis that you will hopefully have undertaken as part of a business continuity program, because that will have defined what your priorities are, the triggers that need you to suspend activities, the triggers to resume activities, the triggers that might mean you have to relocate things, together with the minimum resources required to support those activities. So you've already got much of that information already. You should use that to develop a triage plan. At what point you might need to suspend or reduce activities, and at what point you might need to restart those activities. You need to also to resource things properly. So again, the BIA will provide you with information about what level of resourcing is required to ensure that those activities are maintained at a minimum acceptable level. In terms of people, you have to think about your skills. Who has those skills? Again, the BIA may well already have that information in terms of the skills matrix that you have and the sorts of teams and skill pools that exist. You might have to change work patterns. So what would that mean? And again, the business impact analysis will provide you with some information that will enable you to make those decisions, including things like home working, who is equipped for home working, who has that sort of capability, what time-critical activities that you have on a day-to-day basis can actually be done remotely. There are very often many activities that can't be done through home working or remote working, but at least the BIA will provide you with that sort of information. And if you are a multi-site organization, certainly it should provide you with a picture of the geographical resilience that you have, together with what your options are in terms of relocating, moving work around the organization from site to site. One thing you can use is, and this is an example of a typical template, where you use the activities that you've identified within your BIA and look at what the minimum staffing levels are that are needed for each activity, and use it to perhaps provide you with triggers to ensure that you can resource those activities properly. This is just a simple example, but it's the sort of thing that you can use to adapt your existing business continuity plans and your BIA to help you in terms of pandemic. It's clear that even if you have business continuity plans and strategies in place, they're predicated typically on restarting activities from ground zero. But dealing with COVID-19 is really about planning in reverse. We work down from full production in a debilitating mode towards ground zero. So you use your BIA to identify processes that might be suspended. They're typically the ones that are the last to be restarted. Your business continuity plans should also show what is supportable as staff and core skills diminish. So plan for a situation where you might lose varying percentages of staff up to a peak, for example, from 20 to 50%, and also prepare for a second and third wave of absenteeism over a 6 to 8 week period. Work on the assumption that over time, key personnel and potentially single points of failure will be affected. And if they're likely to be affected, what happens to the key activities that those individuals are responsible for? One way of approaching this is to look at the typical absence levels that you are able to tolerate in a business as usual environment. For example, over the summer leave peak period. And if we're focusing on absenteeism of anything between 25 and 50%, concentrate on that key area within that peak wave of absenteeism. As far as making practical preparations are concerned, a number of areas you need to consider. People, their protection, their support, the skills, the single points of failure, the succession and training in place that needs to be thought about, the technology, and premises. From a premises perspective, maintaining health and safety and alternate site capability, if you do have that capability in place. From a technology perspective, what remote capability and support do you need to put in place if it's not already in place, and what sort of communications are needed? For information, what sort of knowledge bases do you have? Procedures that you need to put in place, access and control to that information, particularly if you're having people operating away from their usual office base. For suppliers, what sort of dependencies do you have upstream and downstream? Tom already mentioned the fact that many manufacturing companies in Europe and North America are suffering because of supplier issues from the Chinese factories that produce the key components. So where are your single points of failure amongst your supply chain? Stakeholders, internal and external, who are they? How do they need to be communicated with? What SLAs are in place? What operational level agreements are in place as well? And their expectations. And finally, business operations. What are your priorities? We just touched on those. How can you suspend certain activities? Again, looking at the BIA, that may well give you guidance in terms of what can be safely suspended. Where are your virtual team or skill pools? What geographical resilience have you already got? We've just discussed a few of those. So make practical preparations. Split site working for critical teams. Enhanced cleaning. Advice and guidance to staff about hand washing and so on. Policies if for HR, if staff are unwell, should they be staying at home? What sort of self-isolation should they be putting in place? And again, look to the health agencies for advice on that. What sort of split working across locations can you potentially put in place to mitigate the impact of a pandemic? What sort of redeployment of staff might you consider? So sending staff either to work remotely, either at home or at other offices. And what about redirecting work, either to other sites within the UK or even potentially offshore? You may well have to consider redirecting work if things continue over a period of time, and think about extended service level agreements. And if you're in the financial sector, FCA forbearance. Suspending non-critical functions using multi-skilled staff and work area recovery provision, potentially with third parties. So think about the unavailability of people, their redeployment, redirecting work, changing working practices. For example, quality checking 1 in 10 entries instead of 1 in 5. Suspending some functions and focusing on the most critical ones, and we've already touched on that earlier. Redirecting customers, for example, advertising to encourage customers to use your online services rather than face-to-face interaction. Postponing or suspending the development and project work that typically goes on, thinking about overtime or extended hours working. Sourcing potential temporary staff might be a short-term option, but there may well be problems on that. And internal secondment as an interim measure as well might be a practical alternative if you have skilled people no longer available. Keep your staff informed. It's essential that they know in advance of and during the pandemic so that you use whatever communication channels you have at your disposal to keep them in the loop. How COVID-19 might affect them in terms of their workplace, what's likely to be expected of them in advance of and during the outbreak. Think about what works best as a message. You need to reassure people while at the same time providing leadership. And remember your key stakeholders in any communication: customers, regulators, key partners. Listen to staff concerns, but also remember that they know how the organization works, and they're very often in the best place to come up with ideas that improve the situation or indeed in solutions. Consult your incident response, escalation and management processes should be clear and ensure that decisions are taken that account for the key priorities identified within the organization. Very often that means asking questions of colleagues outside that pandemic response team and taking their advice and acting on it where appropriate. The triage process, I've already mentioned, referred to, is one where you need to ensure you have up-to-date information from colleagues in order to make the most appropriate decisions about what and when to suspend activities or provide additional resources for those activities. Social distancing and group gathering. Expert medical advice we've covered. Monitor attendance and absence level daily. Ensure that the pandemic response team is provided with that information. Travel and self-isolation policies will be driven by expert advice, but you may have to enforce these and ensure that those staff who are affected are provided with adequate support, particularly if they have to self-isolate. After all, they may be capable of working from home provided they have the appropriate IT and connectivity. Enhanced cleaning and trigger points, we've covered to some degree in the mitigation slide from earlier, but it's all the more important in situations where there's a likelihood that infected staff have been working in the office environment. So deep cleaning may be required in the aftermath of such a discovery. So have you thought who might do this? Or if you already have third parties who offer this service, remember they may have potential problems fulfilling this because of their own staff or material shortages. Technology is essential in instances where remote working is needed. So do you have adequate VPN capacity? Are staff suitably equipped? What about information security? Remember that if lots of people are working from home and schools are closed, there's going to be huge demands on public infrastructure because, you know, what kids are going to do at home all day when they're not at school but watch Netflix and other streaming services. And so you have to think intelligently about how you're going to deploy staff and what they'll be doing. And how are you going to manage third parties who work at your sites? What about cleaning and catering staff who may be employed by third parties who are going to be coming onto your site? Trust professionals. We've already covered those trusted sources of information, government, NHS, World Health Organization, etc. And as Tom mentioned right at the start, trust your staff to do the right thing. They will trust you. Make sure that you're communicating with them and ensure that you consult and listen to them because they'll very often have very sensible things to say about managing the business when you're going through this major hurdle. And remember, the internet and social media can be forces for good and ill. So ensure that you're listening to the right people, as mentioned earlier, government, NHS, World Health Organization, health agencies, etc. Look after the vulnerable. So this isn't going to end quickly. The experience in China saw the initial outbreak beginning in November before it was recognized as a cause for concern in December and then escalating. And as of early March, there is an indication that while China might be over the worst, we've no real idea. And so we have to expect that disruption will continue over a period of at least several months. Higher level of mortality is expected for older age groups and those with underlying health conditions. And that's undoubtedly going to affect staff. And if they're not looked after effectively, there could be ramifications several months down the line after the pandemic has come and gone. So you could be experiencing higher than normal levels of staff turnover as staff leave because of emotional issues, because of related family concerns. So your HR team needs to be actively engaged with people. And that's something that many HR teams who are typically dealing with hiring and firing and things like disciplinary issues or payroll are not typically exposed to on a day-to-day basis. So get them to think about the needs of colleagues and the signs that may be there of anxiety and emotional distress. And finally, hand washing. Now, like masks, hand sanitizer is sold out everywhere. Should you be worried? No, use soap. Should you visit 20 chemists looking for the last bottle? No. Chemists and pharmacies are full of sick people. So what about making your own? No, just use soap. You may have read on the internet that hand sanitizer doesn't work on viruses, just bacteria. Well, the good news is the internet is wrong. It works fine on viruses. If you have some, go ahead and use it. If you don't, use soap. If you have hand sanitizer and soap, what should you use? If you have access to a sink and hot water, use soap. It's easier on your skin, it removes gunk that hand sanitizer does not. What about masks? You don't have any, but if you do, save them for if someone in your household gets sick and get the sick people to wear them. Masks are best at protecting people from you, not protecting you from people. So here's a rule of thumb. If a mask fits well and blocks enough to protect you, it'll be completely unbearably sweaty hell to wear for more than 5 minutes. Ask anybody who works in the NHS. So wash hands, use soap.
Thank you very much indeed.
Yeah, I'll hand over to you, Tom.
Thank you, Ron. So just to conclude, we thought it important to put top 10 tips out there using the benefit of Sungard Availability Services' considerable business continuity experience and also our presence in workplace. We've got a number of clients who are already occupying their dedicated workspace as an opportunity to segregate key staff from the rest of the office population. So run through our top 10 list, consider what you can do to prepare and mitigate for what is almost certainly going to be an uncomfortable experience for the vast majority of us. Thank you for listening to this webinar, and we'd be very happy to get in touch with you. Please contact us through the numbers on the screen here.